Hello friends, I am Dr. Sandeep Bhasin from Carewell Medical Center. Today I'll be talking about blepharoplasty and let's discuss about blepharoplasty. Blepharoplasty is a cosmetic surgery where we remove extra skin and fat from upper and lower eyelid, and this is a very common cosmetic surgery. So commonly we do either upper eyelid or lower eyelid blepharoplasty. If there is sagging of the eyelids also, then we do canthopexy along with that. So what is the procedure in blepharoplasty? Basically we decide how much is the extra skin in upper eyelid or lower eyelid. We do the marking for the incision, which are normally in the natural crease line for the upper eyelid or very close to the eyelashes in the lower eyelid. After giving this marking, we do the incision, remove extra fat pads and muscles, especially in the upper eyelid, orbicularis oculi muscle, and we then stitch the skin together. In case we want to create another eyelid fold like nasal blepharoplasty, then we stitch the skin to the tarsal plate and create an additional fold but in the upper eyelid. So this is how the blepharoplasty surgery is done. This surgery is done mostly in local anesthesia, though sometime under general anesthesia it can also be done. And the patient is usually quite awake while the procedure is being done. It takes about 30 to 40 minutes to do upper or lower eyelid blepharoplasty, and the final results come in about 6 weeks time, or sometimes it take about 2 months to 2.5 months. What's very common after blepharoplasty surgery is there is a post-operative swelling which will remain for about 2 weeks or sometimes up to 4 weeks post-operatively, and which settles down with time. This is a common thing to happen in the blepharoplasty surgery. What are the indications for the blepharoplasty? When should the blepharoplasty surgery be done? Well, blepharoplasty surgery is done, number one, when there is excess skin and sagging of the eyelids, especially when we're crossing the age of 40s and 50s. Under eye dark circles, and that is because of excess dark skin that is there. There is puffiness of eyes because of the fat. There is sagging of upper eyelid because of extra skin. In all these conditions, blepharoplasty can be considered as a procedure. Now sometimes because of the extra sagging skin in the upper eyelid especially, there can be some ptosis and sagging which can decrease our visual acuity. When we remove extra skin by upper eyelid blepharoplasty, it can help us to improve our vision. The other advantage of doing blepharoplasty is it not only makes you look younger and a fresher look, it gives the entire face a rejuvenated look, especially the area around the eyes. So these are the common conditions for which blepharoplasty is very useful. In the Asians where there is no eyelid fold in the upper eyelid, the Asian blepharoplasty is something that can be considered to create an eyelid crease. So these are the common indications for which blepharoplasty is done. Now coming to the complications, that what are the complications of the blepharoplasty? So we must consider that it's a very delicate surgery, should be done correctly. If we excise more skin or more tissue, it can cause ectropion, it can cause leg ophthalmos, it can cause keratinopathies and constant watering of the eyes. It sometimes, if we are not careful about the muscles of the eyes, there can be diplopia in the eye also. So these are various complications that can happen after blepharoplasty. So we have to be very careful when we do blepharoplasty that it is done safely and with lot of precautions, so these problems do not do. Another very common problem with blepharoplasty is asymmetrical eyes, that is right and left eyes may not look totally symmetrical. One may look a little bigger as compared to the other. So these are common complications in the blepharoplasty that we can come across. What are the common things we have to keep in mind after this surgery that are important? So very important thing after blepharoplasty is there is going to be swelling, so do not panic. Keep in mind the swelling takes time to settle. Then avoid using any medications like aspirin, vitamin E, which can increase the bleeding time, which can increase bleeding chances. So avoid all those medications. Avoid driving. Avoid the use of contact lenses few weeks after getting a blepharoplasty. These are few things you have to keep in mind. Proper eye care has to be taken after blepharoplasty. If needed, eye drops have to be used, antibiotics have to be used. keep this area very clean so that infections do not happen. And one thing more, that when we are doing this procedure, we have to be very careful during the surgery that there is no bleeding or excessive bleeding during blepharoplasty. If there is excessive bleeding in blepharoplasty, it may cause problem, and sometimes it can cause increased intraocular pressure and can cause to vision loss also. So something we have to keep in mind, that when doing blepharoplasty, it has to be done very meticulously. There is no excessive bleeding, otherwise it can cause serious complications later on also. So thank you friends, Dr. Sandeep Bhasin from Carewell Medical Center. Thank you.